The Christian County Health Department is taking a lead role in the community as it relates to COVID-19 and coronavirus. And in doing that, we are working with community partners to ensure that we are protecting the public's health while also identifying those who may be in need and making sure they get the proper care and treatment that they deserve.
A lot of the symptoms that we see with coronavirus are mild symptoms. It could be a runny nose, sore throat, coughing, fever. Some of the more moderate symptoms, or if it gets a little more severe, can cause pneumonia and lead to more complications. And in rare cases, we have seen death related to the COVID-19. A lot of these patients who have died have been elderly patients and patients who've had a compromised immune system. So as a public health, we're really taking note of that. We're working with community members who may work with these target populations or these higher risk populations to make sure they're especially taking the precautions they need to prevent the illness in their facility or in their area or among their family. So one thing you can do as an individual to help you from contracting the disease is to avoid shaking hands with others. Whenever you come into contact, maybe you can just kind of acknowledge them with a bow or maybe do a fist bump. I've seen a lot of fist bumps in the community. Avoid touching your face. A lot of times we touch our face more often than we think. The average person can touch their face about 3,000 times a day, which is a prime opportunity to get viruses in your nose, your mouth, and easily spread the viruses.
Jenny Stewart wants to make sure that we have the resources available for patients who are sick. So we are asking if you are well but just worried about COVID-19, feel free to call your healthcare provider to ask questions. There's a hotline that Kentucky has that discusses symptoms, signs, any type of travel information. It's a really wealth of information, but we ask you to stay home. Don't come to the hospital to ask those questions. If you are sick, but you are experiencing symptoms that before the COVID-19 virus outbreak initiated and you would not typically go see your healthcare provider or come to the hospital, we ask that you don't just come to the emergency department or to your healthcare provider. We ask that you call them first, tell them what's going on, let them know your signs and symptoms, and then you can be directed as to whether or not you do need to come to the emergency room or elsewhere. If you are sick and you feel like you have an emergency, absolutely call your healthcare provider. We have an emergency department that is available and ready for you. We do ask if you are being sent to our emergency department with potential signs or symptoms of the COVID-19 virus or any other infectious disease, please give us a call and give us a heads up, and we will meet you before you come into the organization. We will have a mask for you to wear, and we will place you back in a room that does accommodate infectious disease.
So signs and symptoms can be very mild. It could be a runny nose, it could be a cough, sore throat. One thing you really want to look for is a fever. And if you've had any recent travel, if you've been on cruise ships or out of the country internationally, or if you've been around anybody that's a confirmed case, we definitely want to know about those symptoms as soon as they start to show.
COVID-19 is a new disease, but what we have seen so far, as far as the patterns, a lot of kids aren't exhibiting symptoms. Not to say they don't have it, but maybe they have it, but their symptoms aren't as severe. We're seeing the more severe symptoms among the elderly patients and those, I believe, who are 60 or older. So to say kids aren't affected by it is not exactly accurate. They may be carriers of the disease. So they may, like I said, be a carrier, go home to grandma, grandpa, or around friends or family members who have compromised immune systems, pass it on, and then we see the harsher effects of COVID-19.
The Christian County Health Department will be transparent in the matters that if there are a confirmed case in Christian County, we will notify the public as soon as possible and the elected officials. And in doing that, we will ensure the person will get the proper treatment that is needed and will be transparent in all regards to the media with this information.
As far as how it spreads, it's much like the flu. It's through droplets whenever you cough or sneeze. So we recommend that during this time, as we do during flu season, try to stay away as much as possible from large crowds and enclosed areas where everyone's in close quarters. This is just going to give opportunity for the virus to spread. So if you cough or sneeze, make sure you're covering your mouth, make sure you're washing your hands frequently, make sure you're disinfecting your surfaces, and like I said, avoid large gatherings whenever possible.
Over the past several weeks, Hopkinsville Fire and EMS have diligently looked into their policies, procedures. We've looked at CDC for guidance on how we're going to approach COVID-19. And so We have aggressively changed some of our operational measures. All patients will be screened, starting from our 911 dispatchers. Our 911 dispatchers will start asking some questions to our general callers, asking more information about the patient has had a fever, a cough, or has traveled recently, been around someone that has had COVID-19. And so our general public needs to be aware that they're going to get those questions that normally may have not been asked.
I would recommend to people something that I heard in a meeting earlier today. It's the 3 C's. Stay calm, stay clean, stay cooperative. We want you to stay calm in the community. We want you to take it very seriously. We want to do all the things that we can to prevent the spread of this disease, but we want you to stay calm during that. Make sure you're getting information from reliable sources and just taking the precautions that we put out there for you to take to help prevent the spread. We want you to stay clean, keep your surfaces and your areas clean, wash your hands more frequently than you think you would need to or more frequently than you do. 20 seconds at least with warm soap and water. Keep hand sanitizer around. If you work for a company or you're over a company in those common places, make sure you're putting that hand sanitizer out and offering those employees opportunities to keep their hands clean. Make sure you wipe your conference tables down. Make sure you're just keeping these areas disinfected where people congregate a lot. And then stay cooperative. Again, in the community, we have great community partners here. And if everyone will just take valid information, cooperate, provide information that we need, we can work together cooperatively to just take this head on and manage it.